Hello there, this is Dr. Ronald Ritchie. Today I'm going to talk to you about low back pain and core strengthening. The prevalence and causes of low back pain are quite significant. 8 out of every 10 people experience some type of significant episode of back pain at least once in their life, and some many more. What we find is that because of changes in our society, events of low back pain are increasing, not decreasing. Individuals over 40 years of age will experience some form of debilitating back pain where they will spend days in bed because of acute back pain. There are many causes of back pain. Injuries such as falls and overdoing it by working in the yard, sports events, sometimes just simple injuries like picking up a bag of dog food or almost falling, slipping, and twisting and not actually hitting anything but straining the back in the process. Deconditioning is an ever-increasing problem. And what I mean by deconditioning, as you can see there, the couch potato idea. The more we sit around and the more sedentary our work, the less strong and the less stable our muscles and joints become. And this leads to a great deal of softness of the back, in which it can't take much strain. And that simple thing you used to be able to do when you were 15 or 20 years of age, now that you've hit 40, you can't even hardly do it anymore. Just wait until you get to be 65 or 70. And other causes include various underlying diseases, things such as kidney disease, prostate disease, other underlying conditions such as disc deterioration and arthritis, or previous events of back injuries where you didn't really even know that you were injured, but there's an underlying indolent event that causes back pain. All back pain is not the same. Everybody thinks that, well, your back hurts, it's all the same cause. Well, I got news for you. The symptoms may be very similar, but the causes can be very, very different. There are so many different causes for back pain that when a patient presents to a doctor, there is a rather large litany of things that have to be eliminated to know whether or not the person is having a musculoskeletal issue, a kidney issue, a prostate issue, a colon problem, a gastrointestinal problem, uterine disease, many other things. There are just so many things. And like I said, it may not be related to the back at all. These conditions right here, kidney stones, blood clots, prostate cancer, colon perforations from, say, diverticulitis and appendicitis, and even an ectopic pregnancy, which is a pregnancy outside the uterus. I have seen all of these in my own office in the last 37 years I've been doing this. So, not all back pain is the same. What are the medical treatments for back pain? Well, typically medications. That's the number one thing we all do. We go to the store, we go to CVS or Walgreens or Walmart, we pick up Advil or Tylenol or aspirin, and we take all kinds of medications. And generally speaking, when it comes to prescription by your regular medical doctor, the vast majority of the time they'll throw medications at you, which include anti-inflammatories, muscle relaxers, and painkillers. So analgesics, anti-inflammatories, and antispasmodics are what are usually given. And sometimes this helps, sometimes it doesn't, and many times what happens is just prolongs the condition until you finally wear it out or it wears you out and you find some other thing to do. Injections. These are becoming more and more prevalent in which injections of steroids or analgesics and other medications occur either generally or specifically to the joints of the spine. There are now surgically guided injections where they inject medications directly in the spine or in the structures of the joints called rhizotomies or ESIs, and these also will do good. Physical therapy is becoming more common, and the physical therapy is very helpful because, I'll refer you back to a previous slide, people are couch potatoes and we're deconditioned. And a little physical therapy to strengthen and improve mobility and posture will go a long way in getting back pain at least improved. And then last but not least, surgery. By any stretch of the imagination, surgery should always be the last resort. As a matter of fact, there have been statements since the middle 80s about doctors putting off the various agencies, especially government agencies and departments of the American Medical Association, saying that surgeries are being done too commonly on the back, on the spine, and they should be done less often. So surgery should be a last resort. Well, what is the chiropractic treatment for back pain? Well, when it comes to chiropractic, the primary form of treatment is called CMT, or chiropractic manipulative treatment or therapy. What often people call it cracking your back or popping your back does is not make noise. The noise really is irrelevant, and the noise really doesn't mean anything. And as a matter of fact, in all these years, all these decades that research has been done, no one yet has figured out what makes joints crack. Why do they do that? We can walk upstairs and our knees will pop. We can grab a bag of dog food firmly and our shoulders or our elbows will pop, or our knuckles will pop. What causes that? Nobody knows. The popping noise is really not important, but what the chiropractic adjustment to the spine does is three important things. First, it improves joint biomechanics. That means it makes the joints move in the proper way that they're supposed to. Very often, much of the time, with back pain, biomechanics of joints in the spine, either the neck, the middle back, or the lower back, are altered. They don't move correctly, and as long as they're moving wrong, they will cause problems, just like a jammed knuckle, except in your spine. The second thing that happens is the adjustments, the manipulation, relieves pressure from nerve roots in the spine. It literally takes the pressure off by removing stressing agents to the nerve roots in the spine, which will then alleviate muscle spasm, local inflammation, and other things. The third thing it does is aligns the vertebra. The vertebra get straightened up and they line up with one another like our body knows they need to be. And when that happens, when all of these three things occur together, the improvement in back pain is not just immediate, just for the immediate sense, in this reduces back pain today or tomorrow, but keeping the improved biomechanics, keeping the nerve root pressure alleviated, and keeping the spine properly aligned will provide weeks, months, even years of alleviation of back pain. Therapy. In chiropractic offices, therapy today is starting to turn into physical therapy. I think that's kind of a shame, because you can go to a physical therapist and get that. What therapy should do in the chiropractic office is address those three things we just talked about: joint biomechanics, nerve root pressure, and aligning the spine. Things such as muscle stimulator and a machine I love, it's called CMT, constant passive motion. It really helps to stretch the joints of the spine and align the vertebra and get them mobile. And then lastly, and this is the most significant thing, are lifestyle changes. You can do all the physical therapy, all the injections, all the surgery that you want, but if you don't improve your lifestyle, that is, improve your sleep, improve your physical activity, get off the couch and start moving, improve your diet, because diet and eating lots of sugar fuels inflammation, fuels muscle spasm, delays the healing process. Lifestyle changes are absolutely necessary for a long-term resolution of back pain, any kind of back pain. Core strengthening. Everybody talks about what is the core and what is core strengthening. Well, the core of the body basically is from the shoulders to the hips. That's the center mass of the body upon which everything else connects. And that's the part of the body that gets the weakest when we're a couch potato, when we don't exercise, or when our exercise is only sporadic, like 1 or 2 days a week, or we're a weekend warrior and we get out and we do things like crazy on Saturday and Sunday, but Monday through Friday we sit and do nothing. Core strengthening is getting the center mass of the body strong, flexible, with improved postures, because what we're wanting to do is improve posture and body mechanics. If the posture and body mechanics gets improved, then strength can be returned to the body. What we want to do is we want to get the symmetry of the center mass of the body and the central body muscles strong and toned. That is, the muscles on the front of the body, like the chest muscles and the abdominal muscles, need to be as strong as the muscles on the back. And often, the chest muscles are too strong and the back shoulder muscles are too stretched and weak. The center of the extensor muscles of the low back, that's the ones in the back, are strong and the abdominal muscles are weak. And this creates the classic stooped American posture. That needs to be changed. So what we want to do is we want to strengthen, because that stabilizes the center core of the body. We have to have both strength and stability in order to solve long-term back pain issues. Well, when we combine the two, we get the best of both worlds. We not only align the spine, improve mechanics, improve lifestyle, and get that working like it should with all of the necessary neuromusculoskeletal results, but it also changes things for a lifetime. Not just a few months of improvement, but years of improvement. We want to treat the source of the problem, not just take a medication to cover up and mask what's going on underneath. We don't want to do a surgery to change the structure of the spine when the structure of the spine after the surgery will need the same strengthening and stabilization as it did before. We want to strengthen and stabilize the structure of the body, not necessarily just cover it up with muscle relaxers, anti-inflammatories, and pain medications. What we want is quick relief of symptoms, which you can get through CMT and specific therapy, but we want long-term correction for years of relief. That's what I do, and that's what I want to do for every patient that walks in my door. That's what treating low back pain and getting core strengthening must do, and that's what I do in my office. Thank you very much for watching. And if you have any interest, if you have any questions, please call me. My number's on the website, 972-496-9800, and I'll be happy to talk to you. Or just come by. I'll be happy to talk to you then too. Take care.